Hello and welcome to Medical Edge. My name is Todd Barnes. This program is produced as a partnership between the Mayo Clinic and the City of Thornton. We hope every episode provides you with valuable health information for you and your family.
I was breathing through 5-millimeter opening.
Imagine that, breathing through an opening the size of a cocktail straw. That was reality for Jill Pottinger-Moe, who has subglottic stenosis, a condition that happens almost exclusively to women.
It was a real labored breathing compared to people who called me Darth Vader because it was
Just walking through this store would have made Jill profoundly short of breath.
Once I bent over and went to pick this up, I would be wheezing and gasping for air, and there's no way I would be able to talk at the same time.
Idiopathic subglottic stenosis. We use the word idiopathic because we don't know the cause. Subglottic stenosis in and of itself is a scarring of the main windpipe right below the vocal cords.
Dr. Eric Edel and his colleagues at Mayo Clinic have studied this disease and developed a standardized treatment that helps keep the airway open. Here's how. Due to the progressive scarring, the windpipe slowly narrows, severely restricting airflow. During an endoscopic surgery, doctors make 3 small incisions into the scar tissue. This opens the airway and restores breathing. And because the issue will likely recur, patients like Jill are on medication afterwards to treat potential causes of the scarring and inflammation.
So we put everybody on aggressive anti-reflux measures,
plus inhaled steroids and an antibiotic. And if her airway does start to restrict again, Jill can have the surgery again, as many times as she needs it.
It's just so amazing to be able to breathe.
After 7 years of struggling for air, Jill says she's loving life and breathing easy.
And now it's just wonderful. I can breathe, I can talk, I can walk, I can exercise. It's changed my life.
For Mayo Clinic News Network, I'm Vivian Williams. No matter how much you wash your face or apply anti-acne ointment, breakouts still happen.
Some people argue that acne is not a medical disease, but rather a developmental condition because everyone gets acne.
That's the tough truth of youth. The medical term is acne vulgaris, and Mayo Clinic Dr. Don Davis says there are 4 main factors that cause it: overgrowth of skin, clogged pores, oil production, and bacteria called Propionibacterium acnes or P. acnes.
That bacteria grows on our skin all the time, but then once we get one of the other components of acne, which is oil production, the P. acnes has a food source, and then it can grow and multiply easier.
Your immune system fights back, causing redness. Plus, you can get whiteheads and blackheads, which many think are plugs of dirt stuck in pores.
People assume it's due to chocolate or to pizza or to dirt, and a lot of parents encourage their teenagers to scrub their face harder, or the teenager thinks they should scrub their face harder to get out the dirt. But actually what happens is an oxidation reaction between the oil and the bacteria and their byproducts. So instead of having closed skin on top or a sticky plug, the pore is simply congested with bacteria, oil, and bacterial waste. And when this oil gets exposed to the oxygen in the air, it turns brown.
So how do you prevent and get rid of acne? Dr. Davis says start with using your hands to gently wash your face with a mild soap and water. For milder cases, try over-the-counter products that contain salicylic acid or benzoyl peroxide. And if that doesn't work, Dr. Davis recommends talking to your primary care physician, who can recommend stronger medications such as antibiotics or acid products. And if acne is severe or persistent, dermatologists are there to help.
Dermatologists use isotretinoin for very severe acne.
As you can see here, treatment can work. It does take time. Your skin has many layers, and it takes about 3 months to turn over. But with diligence and the right products, most teens can end up with clearer skin. For Mayo Clinic News Network, I'm Vivian Williams.
I felt we were out of control. I didn't feel well. realized we were getting pretty heavy.
And with that came health issues, high blood pressure and high cholesterol. It was time to make a change, so Jennifer and Donald Nospish signed up for Mayo Clinic's new diet program.
It's the healthiest way to lose weight quickly there is.
Dr. Donald Hensrud is the editor-in-chief of the Mayo Clinic Diet Book.
The Mayo Clinic diet consists of 2 phases. The Lose It phase is 2 weeks long, and people make quick changes in their habits.
There's no counting calories or carbs. What you do is adopt 5 healthy habits and break 5 bad ones. The healthy habits are: eat a good breakfast, eat fruits and vegetables, eat whole grains, eat healthy fats like olive oil and nuts, and get moving with some daily exercise. The habits to break are no TV while eating, no sugar except what's naturally in fruit, no snacks except fruits and veggies, eat moderate amounts of lean meats, and no eating at restaurants unless it fits the plan.
In the first 2 weeks, we both lost over 9 pounds.
And once you saw those first 9 go, then it was like, we can do this.
Jennifer and Donald are now on to phase 2, the Live It plan, which is also based on those habits. She's lost 50 pounds, Donald's lost 30, and they've kept it off for over 6 months. Now you might wonder if they felt hungry on this plan. The answer is not really. The calories in 1 donut equal about the same as 6 heads of lettuce, and the calories in 1 brownie this size, about 4 apples.
There's enough experience here at Mayo and enough research has been done that we feel comfortable putting our name on this dietary program.
A program that continues to work for Jennifer and Donald. For Medical Edge, I'm Vivian Williams.
I'm riding the bicycle for about 30 minutes.
Before Rosalie Johns had a new procedure to treat atrial fibrillation, there's no way she could have spent time in the gym with her husband, Darvin.
My heart was beating real hard and I got real dizzy and shortness of breath.
At first, episodes of this irregular heart rhythm happened every month or so, but then they struck almost every day.
It was like a freight train, you know.
Thundering through her chest, her symptoms continued to get worse.
An involuntary thing like breathing seemed like a extreme effort.
Seeking help, Rosalie went to Mayo Clinic, where she met with Dr. Fred Kusamoto.
What you're looking at here is the x-ray or the fluoroscopy of Miss Johns.
You see, atrial fibrillation is an erratic and often fast heart rhythm caused by a misfiring of electrical signals. For the past decade or so, doctors have used radiofrequency ablation to stop the chaotic heartbeats. It works by scarring tissue, which interrupts the misfiring electrical pathways. But it's not perfect. Sometimes the signals can start up again. Now they have another procedure that for many patients may work better. It's called cryoablation, scarring the heart tissue with extreme cold.
Very cold, minus 60 degrees.
During the procedure, Dr. Kusamoto runs a catheter from the groin to the area of the heart where the arrhythmia or bad heart rhythm originates. Once in place, he deploys a balloon that freezes the area. The resulting scarred tissue stops the pathway of the misfiring signals.
The analogy I use is sort of wild Mustangs. If you imagine this atrial fibrillation as wild Mustangs, we make a big corral that keeps the Mustangs within the corral and doesn't allow them to come out.
A procedure that worked for Rosalie.
It has been a miracle, I'll tell you.
She went from not being able to enjoy normal activities to hitting the gym with her husband. For Medical Edge, I'm Vivian Williams.
That's all for this episode of Medical Edge. If you're interested in learning more about any of the stories featured on this program, you can find additional resources by visiting our website and following the link to the Mayo Clinic. Thanks for watching, and be sure to watch the next episode of Medical Edge from the City of Thornton.